in listen-only mode.
Hello and welcome to the 49th Bi-Monthly Breastfeeding Coalition's webinar. I'm Kinkini Banerjee, the Coalition's Relations Manager at USBC, and I'm so glad to have you join us for this session. This webinar series is jointly hosted by CDC's Division of Nutrition and Physical Activity and by USBC. And the webinars referred to as the 222 are held on the second Tuesdays of even-numbered months from 2 to 3 p.m. Eastern. And the purpose of the series is to bring together breastfeeding coalitions to share best practices and news and to network and collaborate on issues of national significance. We alternate the sessions, so we bring you one webinar with a national focus, followed by one that highlights a state success. So in August, Kidada Green and Kendra Rouser from Black Mothers Breastfeeding Association presented a terrific session. And today we have states sharing their highlights. The national webinar is open to all coalition members and breastfeeding advocates, and the announcements are sent through the USBC's coalition announcement list. If you're not already on our mailing list, you can sign up. Just go to the quick link section on our website on the right side of our homepage and click on Sign Up for News and Action Alerts button to join our mailing list. This national 1-hour webinar session will be followed by regional calls. For those of you participating in the region's calls, as soon as this webinar ends, you will have to dial your state's call-in telephone number, and your state's designated contributors manage the call lines for your coalition. All handouts and details are on the webinar page on our website, and you will be also able to access the recording of this and past sessions on the coalition's webinar page. So here's how you do it. When you go to our website homepage, on the right side, you'll see the quick link section. And if you scroll down, the fourth item is the bi-monthly coalitions webinar. Click on that and it will open up the page with the handouts for today's session and the archived recordings and handouts from past sessions. So a few housekeeping details. All attendees are in listen-only mode. We have a big number of participants on this coalition, and we hope to have a lot of questions. We set about 10 minutes for Q&A at the end of the presentation for questions, but do feel free to type your questions during the presentation, and I will pass them on to our presenters during the Q&A time. So to send your questions, here's how you do it. You'll see the control panel on the right side of your screen. In case it's minimized, just click on that orange tab and it'll pop back out. And you scroll down, and just below the audio section is a tab called Questions. When you click on it, it'll open up a text box for you to type in. For any audio problems or any other problems, technical issues with today's session, you can email office@breastfeeding.org and someone will help you. And that brings me to today's topic. The title is Changing the Laws to Change Culture. Today, we'll hear about the Michigan Breastfeeding Network's efforts to change the breastfeeding culture in their state. This June, Governor Rick Snyder signed the Breastfeeding Anti-Discrimination Act into law with immediate effect. Our presenters will share the coalition's action plan detailing how they intentionally focused on so many parallel strategies to build a network of coordinated support and to steer a change in the state law, which not only allows for public breastfeeding, but actually includes penalties for harassment. I am delighted to introduce our presenters today. Shannon Polk is the Executive Director of the Michigan Breastfeeding Network. She was the founding co-chair of Emerging Practitioners in Philanthropy, the Michigan chapter of this organization, and Connecting Leaders Fellow with the Association of Black Foundation Executives. She also created the Passing the Leadership Baton workshop, which became a statewide program of the Council of Michigan Foundations. Shannon has served, whoops, I'm going to change that slide for a second. Shannon has served on the Council of Foundations Next Generation Task Force and the National Philanthropy Committee of the Links, Inc. She most recently served as an Associate Program Officer at the Charles Stewart Mott Foundation. Mac Grambauer works for the McAlpine Consulting and takes a lead role in their marketing initiatives, policy advocacy, campaign work, and strategic planning facilitation. As part of her advocacy work, Mac helps to plan and lead education and lobbying activities, including legislative meetings, web-based advocacy initiatives, and the design and implementation of advocacy trainings. Mac is a year-round biker and supporter of Chicago's Active Transportation Alliance, and I love this, a frantic knitter, as she likes to call herself, and is an avid fan of superheroes, both real and imagined. And with that, I'm going to turn it over to our speakers. Shannon, take it away.
Hello, everyone. As King Kenny said, my name is Shannon Polk, and I'm the Executive Director of the Michigan Breastfeeding Network. We're really excited to be presenting with you today. We had the opportunity to work with McAlpine Consulting for Growth as a consultant for our network as we become a formal organization and a formal 501c3. In addition to their work in helping us kind of lay the groundwork for our organizational structure, McAlpine Consulting for Growth also helped us as we began to move forward with an advocacy agenda. So we're really excited to talk with you about that today. Next slide. So you have here a little bit of the bio that Kim Kinney presented to you, as well as a little bit of the information that Matt presented. If we can go to our objective slide. So our objectives today are pretty straightforward. We are going to talk a little bit about the process we use to move forward the advocacy around the Breastfeeding Anti-Discrimination Bill. I explained to you a little bit of the history of how that came to be, as well as talk with you in greater detail about what we were able to do that helped us become successful in the passage of that bill, as well as some of the challenges that we face in implementing this new advocacy agenda. Additionally, it's our hope that as a result of this webinar today, we'll be able to share some of the strategies that we put into place that we think will resonate regardless of the state that you're in, and will help you have an effective advocacy campaign for whatever issue you may be advocating for in your home state. I'm going to talk a little bit about the focus of the work of the Michigan Breastfeeding Network to give you an idea of where we start. So our work really can be defined in three categories. First is advocacy. That's one of our core pillars of our work. We're looking to see how we can improve the legislative, workplace, and cultural breastfeeding climate in Michigan. And we do that through various activities and events that are focused on advocacy. And we'll talk in greater detail about those events today. Second, we fund coalition building. We have 22 regional coalitions across the state, ranging from the Upper Peninsula all the way down to southern Michigan. And so we work to help support those local coalitions for the work that they're doing. And we try to help them support breastfeeding moms in those communities. And then finally, our third thrust is education. We provide resources for healthcare providers, mothers, other community stakeholders that are trying to support breastfeeding success in Michigan. Now, our goals are pretty simple. Number one, we hope to advocate, always be advocating on behalf of mothers, babies, and their families. We feel that it's a primary part of our mission. Next, we work very diligently to educate our community about the importance of human milk and breastfeeding. There are so many people that still really don't have the fundamental knowledge around why breastfeeding is so important for improving the health outcomes for the children of our state. And then finally, we look to find ways to encourage networking and resource sharing, as well as collaboration among all of those allies who support breastfeeding in our home state. So I'm going to talk a little bit about what is advocacy, because I think it's really good to make sure we're working with those definitions. So Matt, do you want to talk a little bit about this?
Sure. Thanks, Shannon. Hi, everybody. This is Mac Grambauer. And as Shannon said, we, McAlpine Consulting for Growth, our consulting firm, worked with the Michigan Breastfeeding Network in a couple different capacities, but largely my work was in helping further the advocacy efforts of the network around the bill that we're going to be talking about. And so I have just a couple things that I'm going to share with everybody around what advocacy is and what examples of that kind of work is, and how we related that to the network and what they were trying to achieve. So this what is advocacy slide that you're seeing right now has the nice, eloquent, succinct definitions that look really good on paper. When I talk about what advocacy is, I am constantly changing the definition and constantly changing how I talk about it. As Kinkini mentioned, I am an avid superhero enthusiast, and I liken advocacy to acts of superheroism. It's how my brain works, and that's how I like to define it. So when talking about what advocacy is, we've got the examples here of it's working to try to get the government, whether that be federal or state or local level governments, to make decisions that make people's lives better. Really succinctly, that's what it is. But advocacy is so many different things wrapped up in that. And it's really intrinsic to the work that a lot of these coalitions and that, specifically the Michigan Breastfeeding Network was already doing. When you are talking about the stories of breastfeeding mothers or, families, you're advocating for them, even in just telling those stories. When you're speaking up in any way, you're advocating. When you're sharing great articles about the benefits of breastfeeding on Twitter or on Facebook, those are all pieces that flow into this advocacy. That's how we support each other. That's how we support each other's stories. That's how we make our voices heard. And as we start taking those stories and using them as tools to make action and change, that's what advocacy is. So we can go to the next slide, and I'll give some more concrete examples of advocacy. So there's general policy advocacy, which is general education. So when we're talking about the benefits of breastfeeding or talking about policies that exist based on the benefits of breastfeeding, that's all education. Education is something that nonprofits can do as much of as they want, generally talking about the causes and the issues that they track and what that means for the world. That's something that you can just always do and that you do always do through your work. And that's something that I like to point out because there is a lot of nervousness around, well, what can we actually do? What is it okay for us to do? And what should we be shying away from? So when you're talking about those issues that matter to you and those topics that you're focusing on and just doing general education, even if it's with legislators, that's education, and that's totally fine. Lobbying, another example, and it's what most people, I think, comes to their minds right away. That is when you are working to get support for a specific bill. That's direct lobbying. That's when you're going to a legislator and saying, hey, we want this breastfeeding, anti-discrimination bill to pass. And then there's grassroots lobbying, which is when we're working with network members to try and get them to take action to do similar things, to talk to their legislators or to sign a petition or to send an email or make a phone call, things like that. Lobbying is not something that is prohibited. There's a misconception out there in a lot of places that that's something that nonprofits are just not allowed to do. Nonprofits are allowed to do lobbying. There's just rules around how much of it they can do. And generally speaking, the rule is you can use about 20% of your expenditure budget if you're under a certain budget amount on lobbying activities, which is a pretty big percentage. And there's a whole lot more details and different ways around that and explanations around that that are available to folks. But hard and fast rule, you have a chunk of your budget that as a 501c3 you're allowed to use for lobbying. The other big example of advocacy, and something that's getting a lot of attention right now because we are coming up on midterm elections, things like National Voter Registration Day, which happened back in September, things like voter education and getting out the vote, which a lot of people, if you're on Twitter or Facebook or reading any articles on the internet these days, there seems to be something about the midterm elections about every 5 seconds. So that's a lot of organizations and coalitions are really focusing on getting out the vote work to try and boost those voter numbers come November. And that's something that, again, is totally okay for nonprofits. Influencing the outcome of election, that is not allowed, so we can't endorse candidates, but we can tell people it'd be really great if you get to the polls and use your voice to make some change happen that way. If you want to go to the next slide, we've got some more details on lobbying, and this is where we detail a little bit the difference between the direct lobbying and the grassroots lobbying. They are mostly, the rules mostly that it's tied to specific bills, but the difference is speaking to a legislator versus speaking to the public to try and get them to take action about specific legislation. And the next slide is some more rules to remember, and this is where we get to that 20% expenditure rate that I mentioned. And again, that is specific to lobbying, not to the education piece. And there are a lot of great resources if you're looking to get more into the rules for how we can do lobbying. This is something that the network, in our work with them, we used a lot just to make sure that what we were doing made sense and to help explain to people in the network this is why it's okay for us to be doing this and this is why we're doing it. That website that's on this slide, allianceforjustice.org, has a companion website called BoulderAdvocacy.org, and they have a lot of fact sheets and quick Q&A sections that break all of these rules into even more detail. So if that's something that you're interested in, you can go to that allianceforjustice.org website that's on that slide. There's a Boulder Advocacy button, and there's, for an advocacy geek like me, a lot of information that you can spend a lot of time digging into, but then also a lot of information that's really easy to access. If you've got one quick question and you want to find the answer to it, it's a really good user-friendly website. And so that's some of the slides that we used were actually some of the slides, as I said, that we used with some of the advocacy training that we did with the network itself. So you just got a really brief crash course in some of the training that we did with those folks. And I'm going to pass it back over to Shannon, and she's going to talk a little bit more about that process.
Certainly. At this point, I just want to add in that in most of your states, you will have the state nonprofit association. So in addition to visiting the Alliance for Justice website, you'll probably also want to visit your local statewide nonprofit organization website, because they'll also be able to have information on their website that explains what the specific laws are within your state. So Michigan has a threshold whereby which once you pass that financial threshold, you do have to register as a lobbyist, and there are other considerations to be mindful of, and it will be the same in your state as well. So you want to make sure you follow whatever your state guidelines are. So as you can see on the slide here, our major win was that we were able to get the Breastfeeding Anti-Discrimination Act passed on June 24th. What you'll see there are a wide coalition of supporters, as well as some of the representatives from some of our state coalitions, along with some state legislators, female legislators who are supportive of the bill and big proponents. Move on to the next slide. It's really important to understand what this bill does. And for the purpose of the Breastfeeding Anti-Discrimination Act, one of the things that initially was that people were really interested in seeing some type of legislation that would make breastfeeding a civil right. We decided, after some conversations with some of our other breastfeeding allies, that that might not be the best way to get this work done. We knew we needed a bill that was going to make sure that women who are breastfeeding in public would have their rights protected. And so That compromise looks like this, and what we have in our state is an act that prohibits any discriminatory practices and policies, so that women do have a right to breastfeed. As well as, one of the unusual things about our laws compared to some other states is that there's actually a way to pursue remedies if for some reason a mom is discriminated against, and you'll see a little bit more about this on the next slide. So as far as the key components of the law, the first thing is that a mom can breastfeed in any place of public accommodation. And so public accommodation are just those places where a woman has a right to be. So for example, airport, bus station, public transportation, courthouse, retail store. And that's really critical because in our state we had women who were escorted off of a city bus in Detroit. We had a woman who was breastfeeding her baby while she was standing in the back of a courtroom, and she was asked by the judge to leave and stop doing that. And we had a situation where a woman was asked to leave a retail store while she was buying groceries and some other things for her family. So this law makes sure that a woman, any place a woman has a right to be, she also has a right to breastfeed, and that's really important. And then the next thing that is included in the bill is that if a mom is breastfeeding her baby at a place of public accommodation, she cannot be denied service. So in the situations where a woman was asked to leave that retail store, that couldn't happen. She couldn't, nor can any business post a sign or in any way make some type of public statement saying that breastfeeding is not allowed. That is against the law in Michigan. And then finally, probably the thing that's most exciting to breastfeeding advocates in our state is that there's actually punitive measures here. So if someone violates the law, then that mom can bring a claim in civil court for $200 in damages, and also can pursue the cost for any court fees or legal fees that she had to pay for as a result of filing the suit. So that's really important. And move on to the next slide. So Mac and I are going to talk through the next couple slides together. And we're going to kind of walk you through what our process was as we begin to do this advocacy work. So what you have here is a timeline. This work really started in November 2013. And that's when we had our state conference around breastfeeding. And then with McAlpine's help, we created an advocacy committee in December of that year. The following May, we held an advocacy day at our state capitol. We received bipartisan support for legislation, and then in just a few days after that, the bill was signed into law by our governor. And it's really important to note that the bill was passed in less than 40 days after our Advocacy Day event. And that's really key because typically these kind of bills can linger for months without any activity. But by having the Advocacy Day at the Capitol, we really saw legislators understand how important this was to moms, to their constituents, and they became very active about making sure that the bill was moved out of committee and signed into law. Next slide. So, Matt, do you want to talk about the strategic planning process? Because I know that McAlpine helped lead that before I came on board as the executive director.
Sure. So, as Kenny mentioned as part of my bio, our consulting firm doesn't just do policy advocacy work. We actually largely do strategic planning work with nonprofit and public health, et cetera, organizations. And we actually first started working with the Michigan Breastfeeding Network to help them walk through their strategic planning process before I was even brought on board to help do some of the advocacy work itself. That being said, Laura McAlpine, who's the principal of our consulting firm, and Myrita Smiltars, who was a consultant here as well, who helped to do the strategic planning process, helped the group also include an advocacy goal within that strategic plan. And that was really key, I think, to partially how quickly the work that you just saw on that timeline slide, how quickly that rolled out. Because while it was definitely a quick turnaround between the advocacy day and the bill passage, everything really happened at a pretty speedy rate comparatively in terms of getting the advocacy committee together and getting everybody to meet each other face-to-face and look at the advocacy agenda and get all of those things rolling. So part of having that goal into the strategic plan for the network was really helpful. And there was also a lot of background work done on assessing what the landscape in Michigan looked like at the time, and I think some of that was done through the strategic planning process and some after. But reviewing what was happening statewide around breastfeeding laws, but also nationally, because there were so many things that were happening. The Surgeon General's call to action on breastfeeding had come out, I think a year or so before we started really digging into the advocacy work. So just looking at all of those different things that were around and occurring to use those as tools in our advocacy work. And then the network also did a lot of work with other maternal and child health organizations to try and figure out what was happening with the current legislative climate, what was happening throughout the state and in some cases nationally around the work of breastfeeding, and what had worked in terms of doing actual advocacy and knowing where others, what had worked in other states, what had worked in areas in Michigan, and things like that. So there was a lot of time spent trying to figure out, okay, what do we already know and what information do we have that we can use as we do this advocacy work. Shannon, do you have anything you want to add?
Yeah, I just want to jump in here just to kind of recap. So one of the things that's really important to understand is that I didn't come on board as director and say, okay, we're going to pass a bill and this is what we're going to do. There was board and organizational buy-in because advocacy was already part of the strategic plan. And that's really important. You want to make sure that you have that kind of buy-in from your board and from your organizational stakeholders, as well as making sure that you understand what's already happened in your state. It turns out that there had been a push to have a breastfeeding bill passed, but because it was tied to the Elliott Larson Civil Rights Act, legislators were very opposed to opening up that act. And so if we were going to get something passed that was going to protect the right of women to breastfeed in public, we had to look for other avenues. And so by having those conversations with other maternal and child health organizations, we were able to not only understand what had already happened historically in the state, but also build allies to help us think strategically about how we wanted to move forward and help understand what was happening, what were legislators' time in our state. And that was really part of understanding what was happening historically as well as currently. In addition, it also gave us a chance to understand what was happening at the grassroots level as well. Who was talking about this, what outstanding moms were willing to come forward and be spokespersons in their area for this bill. And that was very helpful also. We'll move on to the next slide. So one of the first things we did was at our Michigan Breastfeeding Conference, we included a workshop on advocacy that Mac and Laura from McAlpine Consulting for Growth did for us as part of that conference, which was very helpful to get people excited about the idea of advocating for breastfeeding in the state again. We're really getting them to be willing to step forward and be champions. Mac, you want to talk a little bit more about that workshop?
Sure. So as Shannon said, this is a piece of the full day summit that the network put on, and we brought together folks in a breakout session to look at the advocacy charge and agenda that we had already drafted with the existing members of the advocacy committee and the staff on board at the Michigan Breastfeeding Network. So we had, first drafts of the agenda and the charge ready to go. We did a brief training in what advocacy means, some of those slides that all of you saw earlier, and how people can get involved and, tackling some of the questions that people have around doing advocacy and why it's important and all that type of thing. And then we spent a lot of time going, does this charge for this particular group make sense? And you have actually the final language of the advocacy charge on the slide up right now. So that was something, like I said, that Laura and I helped the board and staff and a couple members of the advocacy committee take a first stab at making the first draft of, and then we brought the other participants from that workshop in and said, what makes sense given your knowledge, your expertise, and what's happening in terms of the language for this, and then also for the agenda pieces for what we're trying to accomplish through advocacy with the network. And a lot of the folks that wound up in that particular workshop wound up joining the advocacy committee. There were a couple folks that I had intersected with through advocacy work with Health Connect One, who does breastfeeding work as well. So there were a couple people that I got to run into and go, oh, hey, you're going to be on this committee because you're great, and I want you in there. And then some brand new friends that were just really interested and wanted to help advance the work. So we talked a little bit around the existing language and in the agenda topics and the charge, and said, what are the real possibilities in Michigan, and how do we start tackling those? And that was the bulk of that section.
And what was really great about that was that, so we already have this built-in momentum that started with the advocacy workshop at our annual conference. So I want people to really kind of understand that this wasn't something that we just jumped up and went to our state capitol and said, hey, we want to pass a bill. There was a lot of groundwork that was done to kind of get people thinking about what those possibilities were, getting them to buy in and have trust with our organization being able to be a leader and a spokesperson on the issue, as well as being able to see what those possibilities were and then see how they could coalesce around one particular thrust where we felt like the time was right to move forward with the Breastfeeding Anti-Discrimination Act. And move on to the next slide. So our advocacy thrust at that point became hosting a webinar in January for the members of the advocacy committee. Mac and Laura joined us and kind of led that webinar, and that was really great because it gave people an opportunity to kind of think more completely about what our advocacy committee was going to do. And then we continue to have consistent contact with those members to let them know what was going on, to let them know kind of where the bill was, as it was moving out of committee, being voted upon in the Senate, as well as moving into committee in the House. As well as we then had our advocacy day in May of 2014, which was really key. We continued to make sure that people were present at the various legislative hearings. That was really key. To continue to keep the pressure on the legislators, let them know that their constituents were really concerned about this bill, that this wasn't just a small group of moms in one part of the state, but that this really was a statewide coalition of folks. One of the ways we kept people who might have been more on the fringes of support informed was through our monthly newsletter, and we consistently put out advocacy alerts, letting people know where the bill was, what was going on with it, letting them know who served on the various committees where the bill might have been in the Senate. It was in the Senate Judiciary Committee as well as the House Judiciary Committee. We're letting them know that way our coalitions from those communities could begin to put pressure on their local legislators. And then continued media presence around the bill itself, making sure that we had local people from the community speaking out on the bill. One of the things that is really key is that you as a leader of your state coalition or on your executive committee and so forth, you need to be willing to share share your voice, your place of voice, I should say, with other coalition leaders. So we made sure that if the person chairing the House committee, if we had a coalition in his area, then we made sure that those people did the media interviews. It wasn't us speaking, it was them, because we wanted them to know your constituents are concerned about the bill. Mac, did you have something you wanted to add to that?
I would just stress to that one, you saw on that slide, consistent, continued, those things kept coming up in terms of communication, and that was really key to keep the momentum of the work going in between those moments where we got to all see each other in person. The Michigan network is a statewide network, so people were spread all throughout Michigan. Myself and Laura, as the advocacy consultants, are based in Chicago, so we weren't even in the state. So finding ways to keep the communication flowing and keep getting updates from coalition members and things like that was really what helped keep the work propelled.
Mm-hmm.
So Shannon, want me to tackle Advocacy Day a little bit?
Sure.
Advocacy Day is when I really let my geek flag fly. I have a lot of fun on Advocacy Days, and Michigan was just an absolute blast. It was fantastic. We had, I think, but at least 50 people who attended as participants, and we structured the day so that participants came to Lansing, to the Capitol, and had a good chunk of their morning where they got to really have an in-depth advocacy training about how do you talk about these issues with your legislators? How do you answer their questions? How do you say gracefully, I don't know the answer to that particular question, but I can help you figure it out? How do you practice your talking points? All those types of things. So those 50 people were in Lansing all day, got some advocacy training. We then had over 100 legislators come and join us in the room that we were in. And what was great about that was it was like watching atoms bouncing around to each other, because it was structured so that congressmen and senators could come through according to their schedules. So there was no set meeting. It wasn't at like 1 p.m. Mary goes to see her senator, and then at 1:30 p.m. she goes to go see her representative. It was much more free-flowing, and people got to hang out in the room and catch their legislators as they came through, and even talk to legislators that weren't necessarily in their district, but that were there to learn more about the work and support the work. And it added a whole new level of energy to the day and was a lot of fun. In addition to that, as legislators were coming in, once there got to be a little bit of a break in that, we sent our participants out to go to their offices in case they hadn't been in the room yet, to go and try and track them down and have conversations with them. So it was a lot of fun. There was a lot of movement around all of that. You can see on this slide, too, we've outlined some of the pieces of education that the participants received, and that was an overview of what was happening at the state and national level, an understanding of what the current laws were and what this particular bill was about. And we also had some of the bill sponsors come to speak about it and some of the topics that they were promoting, and that was also really, really great. We were really appreciative of their time. And it really sparked a lot of energy for the participants in the room, because they got to actually see, oh, these are legislators that are really pushing for what we're interested in, and that's fantastic. And then the last bullet point on here, we had great media coverage. So as legislators were wandering in and out and participants were wandering in and out, following them or tracking them down, we also had cameras moving about the room. It was a really, really fun scene. So I think that's all I'm remembering off the top of my head. Shannon, if you want to take over.
Well, I just wanted to say one of the things that we did was we held our Advocacy Day in the Capitol itself, which I think lent itself to having more legislative participation than you might have if you had an advocacy event away from the Capitol. We were able to get over 100 legislators to attend. Part of that was because of the location, but the other piece was that we served them lunch. And so I've yet to meet a lawmaker who is willing to turn down a free lunch so that you can have an opportunity to have that conversation with them about the bill. And so that worked out very well.
It's a good way to get anybody to show up anywhere for food.
Exactly. The other thing that was really good was by having the bill sponsors there, it was an opportunity for lawmakers to put pressure on other lawmakers to say, hey, you should be supporting this. There are lots of people that are excited about this within both chambers, House and Senate. One of the things we found was that by bringing those bill sponsors forward, there were a lot of female legislators that said, hey, I'm in support of this bill on both sides of the aisle. And they began to answer questions that some of their male counterparts had, and who had some questions with regard to, well, if we pass this bill, what about modesty issues that come up in my district? Well, you know, are they going to be able to breastfeed in houses of worship, those kinds of things. And although they may not have had a relationship with us as members of the network, they knew those other female legislators. They had respect for them, and they were able to listen to their answers to some of those questions. And they became some of our greatest advocates with their fellow lawmakers. We also had a pack of information that included a letter from a female physician from the state of Michigan that talked about her experience with breastfeeding in the state. And that was very influential, so they could see that there were people within their own state that were having these issues, because one of the things that they asked for were specific examples where women had either been discriminated against or had felt maligned as a result of wanting to breastfeed their baby in public. And so having that testimonial, including the packet of information that we shared with them, really put a face to it and gave a very specific way that women were unable to breastfeed, and as a result really needed this type of legislative protection. We can move on to the next slide. So there was also a significant follow-up to the Advocacy Day. We, with the help of our consultants, we were able to put together some additional information for participants, such as letters of thank yous they could send out to their legislators if they met with them, if they didn't meet with them, a way to just kind of follow with them and say, hey, I know we missed you, but here's what I wanted to say to you about this bill, and here's why the bill is important to me. Also, continued media presence. After our Advocacy Day, we had continued media coverage for about a week and a half, maybe even almost up to 2 weeks. And we made sure that local voices spoke to the local media. So that way, if we had someone contacting us from the Grand Rapids Press, we made sure that someone from the Grand Rapids Coalition spoke to them so they could hear that local voice. We also continue to share that information with the advocacy alerts and newsletter that I mentioned earlier. And as well as we continue to make sure that when the bills were in the House committee that we had representation. And we always made sure it was a cross-representation of voices from the state. So we made sure there was always someone from the west side of the state of Michigan, the east side of the state of Michigan. People from various community groups, that there were people of color present, that we had female physicians who were speaking on behalf of the bill. We made sure that our legislators knew that this was not just a small group of people or just members of our network, but that there were a cross-section of people who were breastfeeding advocates, some who might have been doulas, midwives. We had a family physician, a gentleman based out of Grand Rapids. We had advocates from all across the state, people from maternal child health organizations. We wanted them to see that there was a lot of support for this bill, and it wasn't just our organization. And we think that that helped with momentum and ultimate passage of the bill as well. Matt, did you want to share anything about that?
Just once again to stress the importance of the follow-up work. When we contacted Advocacy Day participants, we gave them a lot of tools, templates of emails and letters that they could send to the folks that they met with, along with a report form that said, this is what you said happened in your conversations that day. So your pieces of follow-up were, these 3 things. So make sure that when you're contacting your legislators again, you include that. And I think that was another piece that really went to help how quickly the bill got passed, because it was very obviously not a not an energy that all happened in one day and then it was just kind of gone. There was continued conversation and relationship building, which is what really makes advocacy work successful.
I just wanted to add one other thing, Mac, and that was just the use of the local coalitions. Those 22 regional coalitions were critical to the passage of this bill, whether it was speaking to the local media, writing letters to the editor, contacting their local legislators and saying, hey, I can vote for you and I care about this bill. All politics are local. So when the Speaker of the House realized there was a really strong coalition in his backyard, it made him more willing to put this bill on the agenda and take it up for a vote. We can move on to the next slide. So as you see here, we were so excited when we heard that not only had the Senate passed the bill, but the House passed the bill. And then we received word that Governor Snyder was going to sign that bill in June. And as we all remember from Schoolhouse Rock, our bill ultimately became a law. Let's move on to the next slide. So what are we doing now? Well, we're still paying attention to what's happening. We're listening to our coalitions as they begin to then share with us what they thought we should do next as far as what thrust the Advocacy Committee should be putting their mind in their hands to. And so we're trying to hear from businesses that are saying, boy, how do I support my breastfeeding employees? We're paying attention to hospitals and just trying to make sure we're staying current and making sure we're listening to all the folks at the grassroots level to find out where the pulse is next and what we should be directing our attention to. Secondly, we're looking at ways that we can partner with the Safe Sleep community. In our home state, the Safe Sleep community is extremely visible. And sometimes the Safe Sleep community and the breastfeeding community can be at odds with one another. And so we're looking for ways that we can partner and build on that success, particularly because the First Lady of our state is a strong Safe Sleep advocate. So we believe that one of the ways that we can begin to move our agenda forward is to see if there are ways that we can partner and find some other marquee legislators and marquee stakeholders that become a bigger face for breastfeeding within the state of Michigan. And then finally, encouraging more hospitals to become baby-friendly. We've had a we were really excited because we've had a hospital in Detroit that became baby-friendly. In Grand Rapids, we have a hospital that just became baby-friendly. And so the more we can do that, the more we're going to see the institutional and culture change, which is ultimately what was the motivation behind the law. The law was designed to make it so that women could breastfeed in public, and we know that as more people begin to witness public breastfeeding, the more comfortable they become with it, the more they begin to advocate for it, and it doesn't become something that's out of the norm, but it becomes the norm for our culture. So really, it wasn't just about changing the law, it was about changing the culture in the state of Michigan so that when a mom was breastfeeding her baby at a courthouse, at a restaurant, in a retail store, or using public transportation, that would not be considered abnormal, but considered the best thing for that baby and for that mom. And so we know that by encouraging more hospital become baby friendly, that's another place on that continuum of breastfeeding that we know that will help change the culture as well. So at this point, Mac, if you have something you want to add, we can do that, or we can go to questions. Do you have something you want to add, Mac?
No, I'm good.
All right. The only, so I think we're set with questions.
Terrific. Thank you so much, Shannon and Mac. And as we just heard, the Michigan Breastfeeding Network was so intentional in really targeting their resources in such a smart way, getting the consultants when they needed to, and really using the voices across the state to take their message to the legislature. So many great pieces of tools and strategies and advice that you've shared with us today that are going to help us so much. So I'm going to read out some of our questions. So we have some questions about, if a legislator approaches your coalition about crafting a bill language, and how does that fit within the rules of your 501c3, and do you want to address that at all, Shan?
Yes, and Matt, please feel free to jump in. I just want to repeat the question, make sure I understand it. So the question is saying, what do we do if that state representative or state senator comes to us and say, we want to support breastfeeding, can you help us with the language around that? And does that fall into lobbying, or is that somehow endanger our 501c3 if we volunteer that language?
Correct, correct. If you have a champion legislator who approaches the coalition asking for help with crafting.
Now, Matt, correct me if I'm wrong, but I don't think that is in any way endangers our 501c3 status, because actually that kind of comes behind education, because we're sharing with them the things that our member organizations are saying that, boy, this is what we need in this information, and this is what would be helpful.
Mm-hmm. That's right, yeah, and especially because from what I'm gathering in that question, there's not actually an existing bill yet. What you're essentially doing is providing information for the writing of the bill. So you're right, that's education. Once an actual bill is formed, and you're actually advocating for making that, having that get passed, that is actually lobbying. But that's sort of the trigger moment.
And actually, just to kind of expand on that just a little bit, so when you are speaking with a legislator and you're educating them about why breastfeeding is important, and you're not talking about a specific bill, but you're just sharing with them information, statistics that will help them make better decisions and choices, that's just education. You haven't moved into the lobbying yet. You're just merely sharing with them what's going on. It's not until you begin to advocate, as we did, for the passage of the Breastfeeding Anti-Discrimination Act that you've moved over into lobbying.
Shannon, can you address some of the connections that you made while we have time for just this one question? You said that it was very critical for you all to partner with organizations, other MCH organizations and other public health and community organizations where breastfeeding was not their core issue but a peripheral issue, and how important that was for you to garner support. So could you tell a little bit about that?
Sure. So within our state, one of the pictures that you saw on the slide of Advocacy Day, you saw some women with their children holding up signs. That was actually Black Mothers Breastfeeding Organization. They had taken a picture of the people who rode with them. They actually chartered a bus from Detroit to Lansing. Now, why is that so critical? Having those partnerships was then we were able to show a diversity of moms across the state. So that was one organization that we partnered with, and they showed up in a really strong way on our Advocacy Day. Another organization we partnered with was Mothering Justice, where they advocate. It's an advocacy organization looking at ways to support working moms. So they're doing things like working for the living wage, making sure moms get paid days off, and so making sure that moms can breastfeed in public is not one of their primary issues, but they're certainly supportive of it because they understand how important it is for working moms to have access and have support to be able to take care of their children. So that was one organization that we partner with, and they were very helpful in helping us understand some of the lay of the land because of all the other advocacy work they were doing. Another organization was the Michigan Council for Maternal Child Health, which they advocate on a variety of issues. They were very helpful as we partner with them around trying to provide more Medicaid, more pumps to moms who are on Medicaid who have babies in the NICU. Want to make sure that those children have access to milk. So by partnering, those are just a few organizations, but I wanted to kind of lift those up because although only Black Mothers Breastfeeding has breastfeeding at the core, by partnering with those other organizations, what that did was they were willing to share information. Some of them came and spoke at our Advocacy Day event. They, because they've been doing this work longer and more in depth around advocacy, they're willing to share some of their resources and strategies. And I think it's really important that when you go before the legislature that they see that. One of the things that also happens is that we also had people that came to some of these legislative hearings but didn't even speak but just wanted to have their presence known that they were there and in support of the bill. We saw that with Right to Life and a few other organizations. So it's really important that you're reaching out to organizations that may not necessarily have breastfeeding at the core but are going to be supportive of your issue.
Terrific. Shannon, one last question, and I know there are a lot of questions on advocacy and lobbying, and I would tell our participants to go to the recording and the handouts that we have from a whole advocacy lobbying webinar that we did in the Power Tools session. So this one question was that what were some of the, you must have had opponents to this bill, and what were some of the arguments that you used, especially in terms of the penalty? How did you make that a success?
Well, there are a couple of things. Number one, we had a couple of legislators who were opposed to the bill, and probably one of the key things we did was go to those local coalitions and have those local coalitions have their members speak directly to the legislators and speak to the legislative staff. That was key because those legislators weren't concerned about what I had to say. I wasn't in their district. I couldn't vote for them. But those local constituents, they're going to care because they can vote for them in those midterm elections and in other elections. So their voice really mattered. Also, a lot of what helped was staying on message. So as Mac talked about, we had talking points, and so in every interview, we shared those talking points with all of the people that were going to be interviewed by the press so that the message stayed consistent throughout the state. So when people are going to say, well, what about modesty issues? There was the same response that was given, maybe tweaked a little bit differently, so that way people heard that from the west side to the east side of the state, from Sault Ste. Marie down to Niles, Michigan. We also looked for other, modesty was a big one. In the Republican-controlled House, we knew that there was a lot of support. A lot of those people were thinking that, boy, you know, one of the things I heard was, well, what if someone wants to breastfeed in church? And so we hear that quite a bit. Well, you may recall that Pope Francis talked about the fact that it was okay for a woman to breastfeed at the Vatican. And so when that came up, we told people, well, if Pope Francis says she can breastfeed at the Vatican, certainly a woman should be able to breastfeed anywhere else in the state of Michigan. So by looking for marquee spokespeople, they don't necessarily have to be in your state, but they have to be people that folks can readily identify with and say, wow, that is true. My concern is about modesty. My concern is about, you know, is this going to place a burden on an employer? So we need to talk to them and find examples, very specific examples, somewhat pithy, that we could use in speaking to those opponents to help them understand why this is important. And then we also took full advantage of other legislators who could then speak and say, you've never been a mom, you've never had a child working and pumping or working and breastfeeding. Here's why this is so important.
Terrific. Thank you again so much. As Mac and Shannon said, consistent communication, really very, very consistent, and that feedback loop and really getting the word out, making a plan and working your plan. So thank you again so much. And we move on to the next item on our session today, and it's the CDC announcements. And I'm going to invite Larry Grambauer, the Chief of CDC DNPAO, to give us a few updates. You're on, Larry.
Thank you, Kenny. Can you hear me all right?
Yes.
Okay, great. So I just wanted to let people know what the recipients were of a variety of the funding mechanisms that we put out at the end of last fiscal year. As you know, we're now about 2 weeks into the new fiscal year, but I don't think we've had a chance to announce these. The largest tranche of funding from last fiscal year was for the purposes of supporting peer and professional lactation support in communities. We did a project like this a couple of years ago, and we're extending it now. It is $3 million per year, focusing in on reducing disparities in access to peer and professional support. And that funding went to the National Association of City and County Health Officials. They did an RFP out to communities across the country and had a large response to that. Our intent is to fund 70 communities across the country, and I think they had at least twice as many applications as that. Secondly, I wanted to let people know about the continuation of our support for maternity care practice improvement in hospitals in pursuit of baby-friendly. You know, our previous project with Breastfeeding Beginnings over the last 3 years has been working with 90 hospitals across the country, and that project is now in a no-cost extension through next March, so they have not yet closed out activities but are winding down that project. We announced the new funding to APT Associates, continued at the same level of funding as before, about $2 million per year to work with 100 hospitals. And APT Associates will be coordinating the activities of a number of other subcontractors, including Lactation Education Resources, the Carolina Global Breastfeeding Institute, the Center for Healthcare Quality at the University of North Carolina, as well as Baby Friendly USA. Third, wanted to let you know that we put out funds to support state-level activities in the state health departments, in all of those state health departments that had not previously been funded under our State Public Health Actions Grant. Previously, our funding went to 32 states that had enhanced funds for breastfeeding, and so we extended funding through the Association of State and Territorial Public Health Officials to fund the remaining 19 state health departments. So we're happy to announce that all 51 state health departments, that is including the District of Columbia, have funding from CDC to support the infrastructure at the state level in making changes on maternity care practices, employment accommodations, and peer and professional support. Fourth, I wanted to mention that we have a new contract out now for MPINC. MPINC will be conducted in 2015 by Battelle Memorial, the same company that worked on the MPINC survey before. It is about $500,000 for the administration of the survey, and we will also be working with them on a redesign of MPINC. We pulled together an expert panel this summer to look at how MPINC needs to be improved. We will not be making any significant changes in 2015 since many of these changes take time to put in place. But planning for 2017, there will be some substantial changes to the way we do MPINC. Hopefully all will be improvements. As far as the 2013 MPINC, the benchmark reports have been mailed to the hospitals, or at least are at the printers now, so they're out of CDC's hands and should be in the mail either already or shortly. The state reports and the web tables also are finished with clearance here, and should be posted to our website any day now. So you should be seeing all of those outputs of the 2013 MPINC survey shortly. And finally, we did provide funding in the amount of about $400,000 through various projects with the U.S. Breastfeeding Committee. That will go to supporting state coalitions and providing better technical assistance to them, expanding the partnerships that USBC does, and building a tool to connect moms to resources in their communities, something like a Yelp for breastfeeding so that moms can find the breastfeeding support structures within their own communities. I will stop with that. Thank you very much.
Thank you, Larry. And I guess I might be right in saying that this would be your last 222 with us. And I can't say enough, Larry, thank you. And, you know, a goodbye to a true friend of the breastfeeding community. We are so grateful to Larry for his phenomenal leadership in increasing the national attention to breastfeeding. And with all these innovative efforts that are spreading across the country, this is a very exciting time for breastfeeding. And Larry, you will be greatly missed in the U.S., and we are holding out hope that we will continue to hear from you from Geneva. So thank you again. And I will move on to the USBC announcements. We have very little. And Megan, do you want to make any announcements? Okay, well, I will let you know that our next Power Tools webinar is in November, and it's going to be on grant seeking and grant writing. So stay tuned for that. And our December webinar is going to be the 50th in the 222 series. So we promise to bring you something special. So thank you again to our speakers and to you all for tuning in today. And until next time, goodbye.